Hello all, today I'm going to discuss the underlying causes of vertigo and dizziness in both concussion and PCS. Let's start by clearing up some common misconceptions. Vertigo is a term we use in everyday language loosely, but in medicine, to have vertigo, you must experience an illusion of movement. Either you perceive the external world moving around you, for example, spinning, or you feel like you are moving even though everything else around you appears still. No illusion of movement means it's not vertigo. Depending on the source of vertigo, this can last for seconds, minutes, or hours. Also, vertigo is not a diagnosis, it's just a symptom. Benign paroxysmal positional vertigo, or BPPV, is a fairly common cause of vertigo. It involves being treated with special hands-on maneuvers. But BPPV is only one source of vertigo and accounts for only about 30% of cases. There are many other things that cause vertigo. For instance, post-traumatic vestibular migraines. Very importantly, the treatment needed for different causes of vertigo is markedly very different. If the treatment used is wrong, it may make you much worse. For example, trying to use a BPPV maneuver for vertigo coming from vestibular migraine is a very bad idea. In the rest of this video, I'm going to focus more on what causes dizziness in concussions and PCS. To make your way around, your brain takes in information from all your senses. Your vestibular system, part of the bigger balance system, is located in your inner ear. Beyond telling you how you're moving, one of the very important things your vestibular system does that you may not be aware of is to keep your vision stable. Without a properly functioning vestibular system, your vision and world would be jittery and out of focus, not to mention downright anxiety provoking. How do you think that would make someone feel? Yep, apart from anxious, you'd feel dizzy and off balance. If strong enough or for long enough, it will make you feel nauseous and eventually lead to vomiting. People with a badly working vestibular system or those with a concussion can tell you this is true because they really dislike visually busy places like supermarkets and malls. Add to this a lot of noise and you have the perfect storm for a Blair Witch horror film in your head. Of course, minus the creepy soundtrack. However, dizziness, vertigo, and imbalance can occur in concussions when there's absolutely nothing wrong with your vestibular system. In fact, this is the majority of cases. Dizziness will occur when there is any kind of mismatch between one or more of your senses. This happens because a concussed brain can introduce errors and delays in the processing of your senses, thus giving itself contradictory information. The brain finds this incredibly hard to cope with. A very good example is dizziness originating from the neck. This is called cervicogenic dizziness. In cervicogenic dizziness, problems result from incorrect information being delivered to the brain from your neck. This leads to a mismatch between what your vestibular and your visual system are telling your brain versus what your neck is saying. Your brain's response is, "What the F?" That being said, unfortunately, all too often, I hear clinicians ascribing dizziness to only one thing. Oh, it's all about your neck. In my experience, concussion-related dizziness is most often multifactorial, needing thoughtful assessment and treatment on multiple fronts. Teasing these apart is very challenging. For this reason, I strongly recommend you consult an experienced clinician, one who can carry out detailed neck, vestibular, and visual assessments. If any one of these assessment parts is absent, the practitioner may be missing something very important. Next time I'll cover DIY dizziness treatments plus or minus professional help. Keep on healing. April 10th, 2025, revised November 28th, 2025.